Awesome. So let's see, we are recording, right? Yes, we're recording. All right, so we're talking about hyperpigmentation, and hyperpigmentation affects up to 50% of women. It is, and a lot of men as well. I don't mean to exclude them, but it is one of the most common skin conditions in the world, with really no ideal solution. Now, we are going to talk about different solutions that are used and in healthcare and in the industry. We'll talk about different things that you can do. But if this is something that you suffer from, you're not alone. Many people struggle with melasma. Hyperpigmentation is more of the umbrella term, and then there's different categories, and that's what we're going to kind of go over. Many people struggle with melasma. It's often tied to hormones, life changes like pregnancy, birth control use, menopause. All of this stuff can make you more susceptible. There are very few options for hyperpigmentation. Some of it can actually worsen the problem, and a lot of times you don't know what will worsen the problem until you try it, and then you stop the treatment, and that's when things become problematic. So, just a quick case study. This is Sarah. She's a 40-year-old office manager at Fitzpatrick. So the Fitzpatrick types, you have 1 through 5, or 6 actually, and 1 being like really, really fair skin, and 6 being your darkest skin type. So this is a Fitz type 4. It's medium brown skin tone. It's prone to pigmentation. This particular patient has no systemic illnesses and just has some adult acne. Presents with some dark spots on her face, on her cheeks, forehead, jawline, and the spots developed after active acne, which is a common occurrence. So we have a post-inflammatory hyperpigmentation started about 6 months after acne. Triggers could be stress, it can be hormonal, it could just be picking at acne lesions that can cause issues as well. Previous treatments with acne creams, and we are going to talk about the different creams that are out there. The lesions are just irregularly shaped. They are just irritating to her. She wanted something done with them. So the basic differential that we go through is, what are these brown spots? And it could be melasma. Are they just freckles? Are they solar lentigines, which are just sunspots? So basically, for someone like this, a typical regimen, a topical regimen might be some vitamin C serum, some hydroquinone. You can get 4% as a prescription and use that for 8 to 12 weeks. That can lighten patches. There's chemical peels, microneedling, laser therapy, and just keeping her out of the sun. So we're going to talk more specifically about those particular solutions and what you can do. So in this webinar, what we're going to be doing is talking about what causes and triggers hyperpigmentation to occur in the first place, and treatment options that are out there, what works, what doesn't work, novel treatments that just came out this year, which I'm really excited to share with you, and how you can create an action plan for your skin. So, it can be frustrating and emotionally challenging to have stubborn dark spots or uneven skin tone. And when you're looking in the mirror, you're looking at Zoom. Zoom is one of those things that when you are constantly looking at yourself, it's hard not to be critical, and you notice things. Zoom has really driven a lot of the med spa stuff that's out there now, because people are constantly having to look at themselves. So I'm Katie. I own Philly Wellness Center right here in Philadelphia. It's on 8th and South Street. And, my focus has always been neurotrauma and, really focusing on neuro-wellness. Wellness starts from the inside out, and skin conditions are really manifestations of the inside. So while we work on the outside skin as well, it's really important to focus on internal health as well. And our Wellness Center can help with all of that. Just another real quick case study. This is James, 32-year-old fitness trainer. This would be a Fitzpatrick 6 with dark brown skin tone, highly prone to hyperpigmentation. The darker skin tones may get this, and this might be something that you are familiar with. So generally healthy, does have a history of acne, and just has these dark marks on his shoulders that he is self-conscious about and doesn't want them there. So some of the triggers of this could be friction from tight gym clothing, equipment straps, excessive sweating during workouts. He hasn't done any previous treatments. He's just kind of, said, oh, I'll just deal with it type of thing. But there are options for him. He has tried some body washes with salicylic acid, which can help. But in this case, it really just dried out his skin, and so he stopped with that. So the lesions, we just have irregular hyperpigmented patches scattered across the posterior shoulders, corresponding to locations of previous acne lesions, and that is a really common theme. Mild post-inflammatory redness around some of the areas, but no active acne at this time. And so, the diagnosis really just is this post-inflammatory hyperpigmentation, which in and of itself isn't the interesting part. The interesting part is what do we do about it, and what are the options that we can do about it. So for here, using a lightweight moisturizer with niacinamide. So niacinamide is vitamin B3, basically. If you've ever taken niacin orally, just as a medication, as a pill, it is the vitamin that causes intense flushing, especially at higher doses. So when you get to 250 milligrams or 500 milligrams and you're taking that as a pill, it can cause really, really intense, just like burning. It's like within 15 minutes of taking it, you can get this red flushing of the face, and it spreads through the body, down the arms and legs, and it's very intense. There are brands that don't have flushing, and you can look for sustained release or non-flushing niacin, but it's very effective, but it's not the most pleasant medication to take or vitamin to take. In the evening, azelaic acid, 15% gel, can help lighten hyperpigmentation and reduce inflammation. And the retinoids, we'll talk about the retinoids, but they are actually very, very effective in helping with skin cell turnover and reducing the discoloration. So other stuff that we can do for this are chemical peels, microneedling, and laser therapy, which I will talk about coming up. All right, so let's talk about the hyperpigmentation, what it means, and what we can do about it, because that's what we are all here. So what we're going to talk about is what it is, how to avoid triggers, the options out there. We'll talk about creams, orals, and some other novel therapies that are worth looking into and learning about. And the novel treatments that are like a one-time treatment, which is really exciting, because that has not been available previous to really right now. This device came out at the end of 2024, and we'll talk about that one. So what is hyperpigmentation? Hyperpigmentation is a common skin condition where the skin becomes darker than the surrounding skin. Basically, that's the long and short of it. The darkening happens when the body produces too much melanin. So melanin sits about 1 millimeter under the skin. You have melanocytes, and they give you that pigment. So our melanin is the natural pigment that gives our skin, hair, and eyes their color. Hyperpigmentation happens when you have overactive melanocytes. So that's melanin in the skin cells. The skin cells are the melanocytes. And the primary role is to protect your skin from sun damage, harmful UV rays, but you can also trigger it, and you can trigger melanocytes to produce even more melanin than usual, and that can lead to dark spots or patchy areas. It's harmless, and it's purely a cosmetic issue. But having said that, the cosmetic issue is not something just to snuff at, because it can really impact somebody's self-esteem, their confidence levels. And of course, you can always have spots that need to be checked out by a dermatologist for skin cancer. But if it's not skin cancer, then this becomes a cosmetic issue. But that cosmetic issue can really lend itself to all kinds of personal issues that can affect your career. They can affect how you see yourself. So if it's important to you, then it's important to address, and that should not be minimized by any stretch of the imagination. So it's a common manageable condition, and by understanding its cause and triggers, we can explore treatment options. So causes of hyperpigmentation. So you have sun exposure, that's a big one. Prolonged UV exposure stimulates those melanocytes, the melanin. It causes an overproduction of melanin, which results in the dark spots. Skin injury or inflammation can also do this. So this, after the skin heals from acne or cuts or burns or any type of injuries like that, it can leave behind dark patches, and that's called that post-inflammatory hyperpigmentation. You know, does it, at some level, it doesn't matter why you have hyperpigmentation. The real question is like, how do I get rid of it? Hormonal changes. So pregnancy, sometimes you get, you don't get that mask. They call it the pregnancy mask. And that can be on the face, it can be on the abdomen, it can be anywhere. And the hormonal imbalances can lead to melasma. So melasma is simply a type of hyperpigmentation. So as we use the words interchangeably a lot, but melasma is a type of hyperpigmentation. Not everything is melasma. So we also call things liver spots, sunspot, age spots. A lot of people get those on their hands as they age. I had a lot on my hands that I was, I've been getting rid of because it's, I don't like seeing them. Again, they're not harming me, but it is, it's one of those things that I just feel older with spots on my hands, and I don't like them. So getting rid of age spots, which are simply changes in pigmentation. There's certain drugs, there's chemotherapy agents, some antibiotics. They can also they can trigger pigmentation changes as well as a side effect. And then, of course, just genetics. I mean, you can have freckles, and a lot of people love freckles, but some people don't like their freckles, and they want those to be gone. Different types of hyperpigmentation. Again, the melasma, that can be the large symmetrical dark patches. They can be on the cheeks, the forehead, the nose bridge, the upper lip, and those are generally hormonal changes. They're most prevalent in women, especially during pregnancy. And like I said, that's called the mask of pregnancy. It's also more frequent in individuals with medium to dark skin tones. Melasma is stubborn to treat and often requires a combination of treatments and strict sun protection. So that's going to be a big theme here. The post-inflammatory hyperpigmentation, that is dark spots, and the common locations are face, hands, arms, shoulders, and then freckles. That's another just common, and they tend to be small, light brown spots, and they're generally uniform in color. And again, UV rays can stimulate rays can stimulate melanocytes in people prone to freckles. So that is, again, like it's a common issue, the sun. So if you're not wearing sunscreen, it's something to consider, especially as you start aging. And then just the emotional impact of hyperpigmentation. Like I said earlier, it is purely a cosmetic. The hyperpigmentation, as long as it's not cancerous, is not hurting you, but it can affect your self-esteem. It can cause some social anxiety. And just the confidence that you have, your confidence levels may be affected by hyperpigmentation if it really, really bothers you. So different examples of hyperpigmentation. So the good news is that this can be treated, and there's a lot of different ways to treat it. And we'll go over those, and that's coming up in the next couple of slides. But prevention is going to be your first key. It's always easier to prevent something than to treat something. So using sunscreen to protect against UV rays is really powerful. Protective clothing, which acts as a sunscreen as well. You can use some brightening products like vitamin C or the niacinamide creams, kojic acid. Those are really great products to use. Exfoliating can help promote skin turnover. So these are just some basic at-home treatments that you can do. And then some of the professional treatments to target hyperpigmentation specifically. We're going to talk about creams, oral medications, microneedling, chemical peels, and laser therapy. All right, so the first cream up to bat here is hydroquinone. Okay, this is the gold standard in topical treatments, and it is extremely effective in lightening dark spots. So prolonged use, and this is it's pretty rare, but ochronosis is a bluish black discoloration of the skin. So you go from like hyperpigmentation with brown spots, and now you have a bluish black discoloration, which is not great, but fortunately it doesn't happen often. It's very rare, but it can happen. So which is why hydroquinone is only used for about 8 to 12 weeks under medical supervision, and then you need to give it a break, and you want to give it a break for a couple of months. It is restricted or banned in some countries because of the safety concerns with long-term use, but having said that, it is quite effective, and it's reasonable to do an 8 to 12 week trial with it. I think it's quite reasonable. And if it works, there's some other things that you can use in the downtime when you're not on hydroquinone. And one of those would be azelaic acid. This is a naturally occurring acid derived from like barley, wheat, rye, and it's very versatile. Now, both of these medications inhibit an enzyme called tyrosinase. And tyrosinase, its role is to basically produce melanin. So this is one, and that's really its only role. So the hydroquinone and the azelaic acid, that is what they do. Now, the azelaic acid, it's suitable for sensitive and darker skins. It's very versatile, so it can address multiple skin conditions, acne, rosacea, hyperpigmentation, because a lot of times these skin conditions all go together. It doesn't clog pores, and it's safe in pregnancy, which is a big one because there's a couple of them that we'll talk about that are not safe to use in pregnancy. You can see results, but they might be pretty slow. So it could take 8 to 12 weeks of consistent use to start to see some change in hyperpigmentation. You might get some tingling, itching, dryness, or redness when you first start this. So you want to start slow. I would start slow with all of these creams and work your way up. And it may not be sufficient if you have severe acne or really deep pigmentation issues without combining it with other treatments. But it is a nice treatment to use when you need to come off like hydroquinone, if that's what you're on. Vitamin C is another one this is also known as ascorbic acid. It's a potent antioxidant, and it also inhibits the enzyme tyrosinase, right? So it works just like hydroquinone and the azelaic acid, but it has some additional great properties. So it will reduce melanin production, and it'll help promote an even skin tone. It helps brighten the skin. It neutralizes free radicals. So if you're taking, I would encourage you to take oral, like vitamin C supplements. It's a wonderful, wonderful vitamin, and you probably can't get enough of it. It's water soluble, so you can't OD on vitamin C. You can take as much as you want. It's probably a waste of money to take too much, but if you're using this as a cream, it also helps to neutralize free radicals. It boosts collagen production, which is nice for those of us that are aging, and brightens your overall complexion. So there's a lot of huge benefits to using vitamin C, and it's really nice in the treatment of post-inflammatory hyperpigmentation, which is after your acne or any type of injury. It helps a lot in melasma. where you have that hormonally induced pigmentation. And it's nice to combine it with other treatments as well. It will fade UV-induced dark spots by minimizing that melanin buildup as well. Now, it does come in a lot of forms, but the ascorbic acid is the most potent, but it's also the least stable. So there's other types of vitamin C. So there's L-ascorbic acid. That's the purest and most active form of vitamin C, and it comes in concentrations of 10 to 20%. And it works quickly, but it does require proper storage because it's prone to oxidation, and it's like, you can't keep it in your cabinet for like 6 months. It's something that you need to use up quickly. Then there's like a magnesium type of vitamin C, a tetrahexadecyl ascorbic, which is an oil-soluble form of a vitamin C. So there's lots of different ways that you can use it. But if you start off, with a lower concentration, like a 10%, you can gradually increase that to 15 or 20% as your skin builds up a tolerance. You never just want to go for the most intense cream that you can get your hands on, because you can have a lot of side effects. The redness, the irritation, the tingling, all of that can be an extreme nuisance, and it might prevent you from using it long term, which is not going to help. Now, if you pair this with other things like hyaluronic acid, the hyaluronic acid is really nice because it really enhances hydration, and it can minimize potential dryness that you might get with the vitamin C, or the niacinamide, which again is that B3. It boosts the brightening effects and soothes any type of irritation. The main pro of vitamin C is it's safe for most skin types, including sensitive skin, and when it's used in the stabilized forms. It will fade pigmentation, and it improves overall skin tone. It provides antioxidative protection against environmental stresses, and it boosts collagen production, which is really nice. It can be unstable when exposed to air or light, so it's not something that, again, you keep in your cabinet for months on end. You need to use it all pretty quickly. Higher concentrations can cause redness or stinging. But it's really nice for anybody who has mild to moderate hyperpigmentation, the sunspots, the post-inflammatory hyperpigmentation, and it's easy to get. Like it's a nice treatment that's easy to obtain. Kojic acid. Kojic acid is another one that is a tyrosinase enzyme inhibitor. So it is typically formulated in skincare products with a concentration between 1 and 4%. It can be at higher concentrations. It can really start to irritate the skin. So again, you want to take this low and slow. That's kind of our motto. So if you have dry skin, you can use it once a day. But you do want to pair this with other brightening agents. So if you're going to use kojic acid, you might want to add the vitamin C to it, or you can use the niacinamide cream with it as well. You don't want to use it with a strong exfoliant or the retinoids. So the retinoids we'll talk about in a couple minutes, but you want to use this separately from that. It can be used in all skin types. It's a gentle alternative to the hydroquinone. So if you're on hydroquinone for 12 weeks and you need to come off of it, that kojic acid is a really nice thing to switch to while you're off of the hydroquinone. It's also anti-oxidative, so it'll protect the skin from oxidative stress, helps prevent worsening of pigmentation, and it just basically gives you a brighter complexion, brighter, more even complexion. Some of the side effects with it, you can get some skin irritation, and all of these creams can increase sun sensitivity. So it's something to be very cautious of or conscientious that, when you commit to treating hyperpigmentation, you commit to not spending a whole lot of time in the sun or protecting your skin from the sun in the form of extra clothing or sunscreen, something along those lines. And then the last enzyme that the tyrosinase enzyme that's inhibited in licorice extract can be used. This is a cream that works in the same way as vitamin C, the kojic acid, azelaic acid, and hydroquinone. So they're all in the same class of creams that do essentially the same thing with a different side effect profile. So it does inhibit the tyrosinase, which prevents, it reduces melanin production. That's basically what what happens when you block tyrosinase. And it prevents the formation of new dark spots from coming. It also protects against UV damage, which is really nice, and it has that anti-inflammatory action. So it can reduce inflammation that can trigger post-inflammatory hyperpigmentation from acne or any kind of skin irritation. It will help brighten skin. It's gentle, non-irritating. It can reduce redness, and it's very versatile. So you can use it really for anything. It's found in a lot of serums and creams and spot treatments, and you can apply it after cleansing and before like the heavier moisturizers or sunscreens. And you can use it every day, which is really nice. So there's no problem with this. There's very minimal risk to licorice extract. It's generally safe. It's well tolerated. There's really no downside to licorice extract. So it's something that you can use quite liberally. All right, so the retinoids, tretinoin, adaptoline, retinol. So these are a class of compounds that are derived from vitamin A, and they're very, very widely used in skincare for their ability to improve skin texture, treat acne, reduce hyperpigmentation, and minimize the signs of aging, which is why they're so popular, right? Because they work and they're great. But they work by binding to the retinoid receptors in the skin that regulates cell growth, turnover, and repair. So what does that mean? It means that it accelerates cell turnover. So the retinoids speed up the rate at which skin cells are shed, replaced, which prevents clogging of pores and provides a smoother skin texture. And they also increase collagen production by stimulating, they're called fibroblasts, and that produces more collagen and elastin, which as you age, this becomes more important because that collagen and elastin are what make the loss of collagen and elastin are what make your face start to droop and you know it creates the wrinkles and fine lines. So the retinoids help to prevent loss of collagen. And they also, the retinoids regulate melanin production. So it helps to fade those dark spots and even out skin tone by promoting the removal of melanin-laden skin cells. It also reduces sebum production, so lowers the production, making it more effective for acne-prone skin. So if your skin is very acne-prone, retinoids they're pretty much first line for acne because they're extremely effective. And they have some anti-inflammatory properties. So they can calm inflammation that's associated with acne and even rosacea. So the benefits, again, are they're anti-aging, they can treat acne, and they can treat the hyperpigmentation, they can improve skin texture and brighten skin. So it's like, well, why wouldn't you want to use retinoids? Well, there's some side effects to the retinoids that you do need to be aware of. The retinization process can cause redness, dryness, peeling, and sensitivity, especially in the first 4 to 6 weeks that you're using this. So this might be something that you have to, again, start low and slow. Maybe you use tretinoin like once a week and then twice a week, and then you have to build up to it so that you don't have, you don't get that really intense peeling. It will absolutely increase your sensitivity to the sun. So the retinoids thin out the outermost layer of the skin temporarily, and it makes it more vulnerable to UV damage. So you have to be very, very protective of your skin when you're on retinoids. It can also cause purging. So even though it unclogs pores, it unclogs pores. So you might initially have those clogged pores the substance might come to the surface, causing temporary breakouts. Dryness, it can disrupt the skin barrier, leading to flakiness or lightness. And it's absolutely not safe during pregnancy. Definitely do not take this if you're trying to get pregnant or you are pregnant. There are potential risks. They have done studies on this. The problem is that the retinoids are involved in gene expression, especially organogenesis, right? So in making organs. So when a fetus is developing, the cells have to differentiate, and they differentiate into a liver, or they differentiate to bone, or they differentiate into your brain. The retinoids, because they regulate gene expression, can prevent that differentiation. And then you get all kinds of problems. You get neural tube defects, you can get cleft palates, limb malformations. So you want to avoid that. In adults, you already have all your organs, so that is not a concern. It's a concern only in the developing fetus. So definitely don't take it if you are trying to get pregnant, because those early days are really, really important. But if you're not trying to get pregnant, or you're way past that time in your life, you can start slowly, begin with a pea-sized amount 2 to 3 times a week. You can increase. Eventually, you want to get to nightly and use that as tolerated. You also want to use a moisturizer to minimize dryness and irritation, and absolutely sunscreen, or you just need to prevent too much exposure to UV light, because there's such an intense cell turnover. So you can use this if you are you have acne, fine lines, hyperpigmentation, and you want smoother, brighter, more even skin tone. Absolutely not for pregnant or breastfeeding individuals, or people with extremely sensitive or reactive skin. Now, how to know if you're using too much retinoids, right? So you can have excessive cell turnover, and the signs of excessive cell turnover are going to be dryness and flakiness. So you can have excessive shedding, and that can be really irritating. So visible peeling or really rough patches of skin, you might want to back off the retinoids, right? The redness and irritation, increased sensitivity, consistent and persistent breakouts, a compromised skin barrier, and over exfoliation. So too much cell turnover can actually worsen dark spots or post-inflammatory hyperpigmentation. So you have to find that balance of where you have enough retinoid on board, but not too much. And that is going to be different for everybody. So it's unfortunately one of those things that you have to kind of figure out by trial and error. All right, niacinamide. We just have a couple more creams to get through, and then we'll move on to the next category. But niacinamide, it increases the production of ceramides, which are lipids that help retain moisture and protect the skin from damage. Now, niacinamide comes from B3. B3 is the water soluble vitamin that I told you earlier. I actually take niacin in the morning, and it's, oh my God, it's an intense experience. If you've ever just taken niacin by itself, and you get the flushing experience, you kind of want to like go out in the snow and put ice on your face, because it's that burning sun, that flushing is intense. But it's anti-inflammatory. It's different in the cream. So a niacinamide cream is actually going to be very hydrating, and it does have antioxidative properties. It's anti-inflammatory, and it helps balance out oil production. It will hydrate and strengthen the skin, brighten the skin tones, soothe out inflammation, treat acne. So it's suitable for everybody. So it's suitable for oily skin, dry skin, sensitive skin, combination skin. And you use it with hyperpigmentation. It's a really nice cream to use for hyperpigmentation. You can use the 2 to 5%, which is ideal if you're just starting out. 10% or higher is for people who are concerned about hyperpigmentation, and who are also not beginners with using this type of cream. So you can apply it in the morning and the evening. You want to do it after cleansing, but before moisturizing. And it does pair well with the retinoids or vitamin C, but can cause some irritation if you're using it with exfoliants like the AHAs, the alpha hydroxy acids, which we'll talk about in like 1 minute. Whoops, go back. I skipped over them. So the alpha hydroxy acids, they exfoliate dead skin cells, so they weaken the bonds between dead cells on the surface and allow them to shed more easily. And that gives you brighter, smoother, healthier looking skin. By encouraging faster cell renewal, AHAs help reduce the appearance of fine lines and discoloration. They also hydrate the skin and can improve collagen production. There's different types of AHA. So there's the glycolic acid, there's lactic acid, mandelic acid, citric acid, malic acid, tartaric acid. So there's a lot of different acids out there, and you want to talk to your esthetician about, or your dermatologist, like which one should you be on, because the glycolic acid and really high doses of or percentages of glycolic acid are really, really great for hyperpigmentation. We had a group come in to Philly Wellness Center from Ethiopia, and they owned 2 major spas over there. They have like 8,000 patients, and they work with the Ethiopian population. And hyperpigmentation is a big issue. So they use a 70% glycolic acid as a chemical peel to help with hyperpigmentation, because they found that was the only thing that really was effective in their patient population. So it is something that we've been learning from them about how different ways to treat hyperpigmentation, and that is one of them. So the AHAs will help fade pigmentation. It helps lighten the dark spots, melasma, the post-inflammatory hyperpigmentation, but they can be irritating, right? They can cause redness, they can sting, they can burn, especially at really high concentrations. So a 70% glycolic acid is not something you use every day or even every month. Like, this is something we would use potentially quarterly after we've built a certain tolerance up to that level, but it's not something you would start out with. You want to start slowly. Low concentrations, particularly of a glycolic acid, is 5 to 10%. So 70% is obviously way up there. But you can use this in anybody with hyperpigmentation or dull, uneven skin. So there's a lot of different ways to use this. They can interact. The AHAs, the alpha hydroxy acids, can interact poorly with certain potent ingredients, such as vitamin C, retinoids, and benzoyl peroxide. Now, the alpha hydroxy acids and the retinols are the 2 medications that whenever you go to a wellness center or med spa, they're going to be the 2 medications or creams that they ask if you're on. And one of the reasons that they ask you that is because these 2 categories of creams cause a lot of skin turnover. So if we're going to do a chemical peel, we're going to do Botox, we're going to do even a facial, right? The skin can already be extremely irritated. And if you're on these medications, it can make it worse. So in most cases, they will ask you to come off these medications for at least a week and maybe up to 2 weeks before getting a treatment. And that's why, because the skin, with the cell turnover, the hyper cell turnover, it can be very dramatic. Tranexamic acid is a synthetic derivative of lysine, which is an amino acid. Very, very popular. It can block the interaction between the melanocytes, the melanin producing cells, and the keratinocytes, which are skin cells. So that reduces the production and transfer of melanin. It reduces vascularization. It's anti-inflammatory. It prevents UV pigmentation. It can target hyperpigmentation. I like to inject tranexamic acid with a mesotherapy. So mesotherapy is injecting substances underneath the skin. And we'll talk about that in, I think, 1 or 2 slides, but you can use niacinamide, vitamin C, hyaluronic acid, tranexamide acid. You can use all of these in mesotherapy, inject them under the skin. or in specific spots that you want to really decrease the hyperpigmentation. So it is typically found in concentrations in creams about 2 to 5%. And it's ideal for localized treatment of pigmentation or just brightening the overall complexion. There's also an oral dose of it. So typically, if you're prescribed an oral medication, tranexamic acid, it's about 250 milligrams twice a day, particularly for persistent melasma. And you just want to watch for side effects. And one of the side effects can be blood clots. So if you have any history of blood clots, you would not be a candidate for this. So, I mean, you can still use it topically, and it's something that you would want to put on after cleansing before hydrating or moisturizing. Topical side effects of topical use can be mild irritation. Rarely, it might cause some mild redness, dryness, itching. And oral use, there is the very rare risk of blood clots if you have a clotting disorder, and we don't use it in pregnancy or breastfeeding. I always say the two things that are the scariest in medicine are anybody that are pregnant or cancer, who have cancer going on, because those are the two things that we generally, it's always difficult to treat those patients. All right, so if you are going to get over-the-counter creams, just a couple things to be aware of and to think about, because there's a lot of products out there that lighten skin, brighten skin, and they can actually make things worse. So you just want to be aware when you read the ingredient list. Products with high alcohol content, like a denatured alcohol or isopropyl alcohol or ethanol, can dry out and irritate the skin and disrupt the barrier over time. So astringents, toners, they're marketed towards oily or acne-prone skin. Just be very careful of them. And overuse will cause redness, irritation, and actually increased oil, because the skin's trying to compensate for the dryness. So it's actually, I would save your money and just not buy that at all. Products that are harsh exfoliants. So a lot of these brands, these creams are already exfoliants. They're causing cell turnover. So you don't need to do like very high concentrations. So your alpha hydroxy acids are causing exfoliation to begin with. So, doing a DIY chemical peel on top of it is going to make your skin really, really irritated. So anything over 30% glycolic acid, I would really save that for your esthetician that you're working with, so that they can make sure that it's not too much. Unregulated ingredients. So some of the over-the-counter products, especially from less reputable brands, may contain unregulated or harmful ingredients, including steroids, which are often found in whitening creams. And when you get steroids, if you stop taking that cream, there's a rebound effect. And this happens in steroids, no matter how you're taking steroids. There's always a rebound effect when you stop steroids. And in this case, it can be worsening of whatever condition it was fixing in the first place. So if it was lightening or whitening the skin, it's going to get hyperpigmented as soon as you stop taking it. And hydroquinone, high concentrations greater than 2%, can just be dangerous. So you want to make sure that you have medical supervision and somebody's watching that. There's a lot of imported or counterfeit products that are out there that don't meet FDA's safety standards, or they're not even required to go through them. So you want to go with a brand that's been around, that is reputable, and you trust them, which nowadays it's getting harder and harder. But I would say that if it's super, super cheap, consider that the materials that they put into those creams are going to be super, super cheap. So that, I always think about that. You don't have to buy the most expensive creams on the market, but you also generally don't want to go with the cheapest creams that you can find either. Anything with synthetic fragrances, I would avoid. They can trigger sensitive skin and allergic reactions. Skin lightening products, they can also contain illegal ingredients like mercury or the high-dose hydroquinone, and that can be really problematic. So unlabeled or imported whitening creams from non-reputable brands, please stay away from them because they can cause mercury poisoning, skin thinning, and irreversible skin damage. And then sunscreens with oxybenzone. So sunscreens containing oxybenzone have been linked to skin allergies and potential hormone disruptions. So something to think about. Some older formulations of chemical sunscreens are an example of this. So it's something you really want to be careful and mindful of. And it's unfortunate that we have to do this, but the cosmetic industry has never been regulated. And I think they came out with suggestions back in the early 1900s, and that's never been changed. So there's all kinds of crazy ingredients in cosmetics, creams. So you want to buy from reputable sources, maybe do a patch test to make sure if you're working with a new product, just use it in a small area of skin before really committing to it. And then just in general, avoid homemade products unless you really know what you're doing. Red flags in these products are they're unlabeled or incomplete ingredient list, instant claims like instant whitening or overnight results, if they're imported with no FDA approval or safety regulations, and if they have really strong chemical smells or unusual textures, those are generally your red flags. So just an example protocol, you can use a cleanser and let's say a vitamin C with a tranexamic acid and a moisturizer, apply the retinoids at night, get your monthly chemical peel and facial. You might get the quarterly microneedling, 70% chemical peel. And for more severe cases, you can add oral agents or prescription hydroquinone and add those to your cycles. For oral medications, you can certainly use the tranexamic acid. There's glutathione is another really great medication. So glutathione is a very powerful antioxidant. It reduces oxidative stress, inhibits melanin production, and shifts the melanin synthesis from dark pigment to lighter pigment. It will also detoxify cells, reduces inflammation, and prevents pigmentation triggered by cellular stress, which is really nice. You can take that, and antioxidants like vitamin C, vitamin E, and vitamin B3, if you can tolerate it, are really nice. And the last one on this list is NAC, which is N-acetylcysteine. That is very liver protectant. It'll also boost your glutathione levels, and it reduces inflammation associated with pigmentation. So if you wanted to take some oral supplements to help improve your inside, glutathione, vitamin C, and NAC would be my supplements of choice. And I do actually take those every day, among other things. I got a list of like 20 things that I take every day, but those are definitely on the list. All right, so chemical peels. Chemical peels are skin treatments that use acidic solutions to exfoliate the outermost layer of the skin. They remove dead and damaged skin. They promote cell turnover. You just want to be careful if you're on the retinoids or alpha hydroxy acids, because those are also promoting cell turnover, and you don't want to do too much cell turnover, but they're very, very highly effective for treating hyperpigmentation. This is something that we add into some of our memberships. We'll do chemical peels on a monthly basis, and then a deep or super deep peel on a quarterly basis. That 70% glycolic peel, if we can get you up to that level. I mean, some people just can't tolerate it, but if you can, it's incredible what a chemical peel can do for hyperpigmentation. So microneedling and laser, this is, I want to show you the results from laser, which has been really, really impressive. So, microneedling, this will also induce collagen therapy. It's, basically making micro injuries in the skin, and that can trigger the skin's natural healing process. It stimulates that turnover, breaks down melanin deposits and reduces post-inflammatory hyperpigmentation. So it's really great for all skin types, including the darker skin types. This is really effective. And it's something that you can do it. A lot of people do it quarterly, or you can do it 3 times and then maybe every 6 months from there. Now, the thulium laser is what we are using, and a thulium laser is a laser that operates on a 1927 nanometer wavelength, and it targets the epidermis and the upper dermis without significant damage to the deeper layers. And it's really, really nice because it actually targets water and not melanin. So one of the problems that we've had in the past with lasers, particularly in darker skin, is that you can't use it at high power. And if you can't use it at high power, then you can't get the hyperpigmentation to go away. It is just kind of like spit in the ocean. Like you can't get any effect. So this has been a huge problem in the industry for the darker skin tones. Because the CO2 laser or the erbium lasers, they're just not effective for darker skin tones. So what the thulium laser does is it targets, the wavelength is highly absorbed by water, which helps it to break down excess pigment without harming the surrounding tissue, which is really, really nice. And it's like it literally sucks the pigment out of the skin. So I've done this with a lot of people, especially my postmenopausal women who have age spots on their hands, and I do my hands all the time. Not all the, like I like to use I've used the laser for the sunspots because that was driving me crazy because I see my hands all the time and I can't stand it. So I've used the laser to knock out, and it literally sucks the pigment out of your skin. So it's called Nuvaderm, and this just came out late last year. So in Q4, it came out from AMP, which is Aesthetics Management Partners, and it utilizes that cutting edge methods to rejuvenate the skin by promoting cellular turnover, which is exactly what some of the other creams are doing. So let me show you some of the pictures that we have. So in this, you can see this is one treatment. So it's not like you need 50 treatments of this. This is one treatment. You can see the hyperpigmentation on her, on the left side, and it's gone on the right. And we can use a stamping motion, and then even at a micro dose, you don't actually need numbing when you're using the micro level or the stamping. You can certainly use numbing if you're hypersensitive. And then at the higher power levels, we would use numbing for sure. But it as is non-invasive and painless, which is amazing because there's nothing out there that does what this does, especially for darker skin tones. And you can see here, this is also one treatment, and it was 6 months after the first treatment, but one treatment, and it took away that hyperpigmentation on her forehead. Now, this is just a picture of, this is like using one of the skin analysis pictures, and you can see on the left, you can see the freckles and you can see the hyperpigmentation. It's not all completely gone on the picture on the right, but it's significantly reduced. And we can get a lot around the eye as well, and right up to the lash line with this particular laser, because there's different patterns to it. So we're not stuck with like one big circle. I can use a line. I can use, different types of stamps. I can make the shape, whatever shape I want, so that I can get to the area that I need to get to. It will address hyperpigmentation. It literally sucks the pigmentation out of the skin, which is pretty amazing. And then it works on fine lines, wrinkles, uneven skin tone, all the things that we're all concerned about all the time. So another sample, this is from the company itself. This is one of their pictures, but you can see on the left, she does have the hyperpigmentation. That's like the pregnancy mask, the melasma from pregnancy. And on the right, 15 days after a single treatment, and that pigmentation is gone. It is fast recovery. Sometimes you just need one treatment. Sometimes you might need 2 or 3 treatments. but you can resume your activities. I like to use exosomes on everybody, so even if there's a little pinkness immediately after, that is wiped away with our with exosomes, and nobody but you can tell that you had anything done, unless of course you're using like the ablative. You might need a week's time off for ablative because it literally takes off the top layer of the skin. But for pigmentation, that's a stamping technique, and it doesn't require as much power to suck that out. And you can see that on this woman as well. So this was one treatment, and the skin just looks better. It looks better on the right. She had some pigmentation issues along the cheek line there and along the jaw line, and those just cleared up. And the skin just looks brighter and better. And, taking pictures in the right light and the right um, in the same angle is really important, because you don't want to overemphasize or try and sell you something that's not real. But this is one of the machines that I've been really, really excited about because of what it can do. It also improves this redness. So if you do have rosacea, that is minimized with this as well. And it's for all skin types. Again, like we don't have to say no to skin types 4, 5, and 6, because this will work. And my admin at my clinic, we've been doing her dark spots. She's a Fitzpatrick 5, and we've been doing dark spots on her shoulder, one treatment, and they are clearing up, which is really exciting. You can do it any body part, and it literally takes minutes. So this isn't a long procedure. Unless you have to numb, then that takes like 30 minutes. But if you're not numbing, you can be in and out in 5 minutes. It's long lasting too, though. It's the other really, really exciting aspect of it. And again, just some more pictures. Now, aside from the laser, there is one other thing that I want to share with you. So anybody that's interested in skin lightening protocols, this again came from the Ethiopian Med Spa. They are very into the skin lightening. And basically it's an infusion of glutathione and vitamin C. Now, if you remember earlier, we were talking about glutathione and vitamin C oral supplements. You can absolutely take those, but the infusions are a very popular treatment for achieving a brighter, more even skin tone. These infusions are delivered IV, and it's a series of 9 treatments. So it's a very high dose of glutathione and a very, very high dose of vitamin C. You do need lab work for vitamin C infusions, but once you have that, and we make sure that you're not G6PD deficient, then we can give you these high doses of vitamin C. And they brighten the skin, they promote even complexion, they detoxify the skin, and they boost overall wellness as well. And it makes the laser even better because, as I told you, the thulium laser targets water. So you need to be hydrated to have a laser treatment. So what better way to do that than to get an infusion of glutathione and vitamin C, plump up, improve the skin quality from the inside, and then use the laser on the outside. So this is a really, really great way. Typically you would need, like I said, 9 sessions for this, and it will last for several months after that. And then you would do like an infusion, maybe quarterly, of vitamin C and glutathione. So I think 9 sessions is like $1,900. But if you're doing a single session, you're looking at maybe $200 for a single session. But yeah, the vitamin C is 15 grams. The glutathione it's a high dose glutathione. It does require lab work to be done. But these are like the really exciting things that we have to offer at this point. So we're at Philly Wellness Center. If you do come in and you're interested in working with us, we do a derm consultation. We'll do a skin analysis, which will evaluate your skin, your type, and your sebum, your melanin, your hydration levels. We do offer prescription creams and oral medications. I'm a nurse practitioner, so I can do that. We offer a skincare line. We focus on Epicutis because it's the only professional skincare line that doesn't have toxins in it. But we do offer chemical peels, and we do offer 70% glycolic acid. Once you work up to that, we're certainly not going to do that on somebody that we don't know anything about your skin. We have to build up to that. We do medical grade facials, microneedling, and we do Morpheus, which I do love Morpheus. And we do a skin lightening infusion protocol with glutathione and vitamin C. And then on the other side, if you're translucent like me, you might want the skin darkening protocol, and we use peptides to help darken the skin. We use a peptide called melanotan, and that will make you tan. So if you are looking to darken the skin, it is very protective. The melanotan is very protective of UV rays. And it protects the skin from damage, but it will make you tan. And then we are the only place in the city with Nuvaderm at this point that will remove hyperpigmentation, it improves skin texture and tone, and it's long-lasting results. So I did want to share the price of Nuvaderm, so you know that it's not completely off the mark, but you know, the treatment starts at $250, and a lot of times you just need one treatment. So these are generally what you're looking at for using the laser. And if you guys are interested, we'd love to have you book an appointment with us. You can do a free consultation to start, but feel free to contact us. And you know, if you have issues with hyperpigmentation or aging skin or any of those things, you know, certainly book a consult, and we'll be happy to talk to you. So that's all I've got for tonight. I'm 3 minutes over, but hopefully this was of interest to you and will help you with your concerns for hyperpigmentation. And, you know, again, please feel free to call us to learn more. Thanks, guys.